Before speaking about Medicare for All, I think it's important to think about, sort of frame our entire discussion about what the business model of commercial insurance actually is. The business model is predicated on taking in as much money as you can in premiums and paying out as little as you can get away with in healthcare. And the difference between those two is where they make their profit, okay? So always keep that in mind. When I talk to people about Medicare for All, and also known as single payer, sometimes folks are, scared or misinformed. They think a lot of things about healthcare, but I think as long as you bring it back to that the system we have now serves profit, and that's all it does. It's supposed to do that. In fact, insurance companies are legally obligated, if they have shareholders, to do that. What they don't do is add anything to health or healthcare. So I'd like to start with that. Maybe the best way to think about what Medicare for All is to think about what it's not. I want to talk a little bit about some of the myths. Medicare is not socialized medicine. It is public insurance. The medical system itself, in terms of how doctors function, how hospitals function, the work they do, that is not going to change. What's going to change is how it's paid for, the payment model. And the Medicare for All trust that Senator Eldridge just described is a far simpler, more efficient, and less expensive way to pay for health care. It also allows the state to negotiate costs in a way that a multi-payer system of dozens and dozens of different health insurance companies and plans cannot. And I'll come back to that in a minute. It also, as the senator mentioned, doctors and nurses are spending an enormous portion of their time every day with paperwork, arguing with insurance companies who, I might add, are not medically credentialed, trying to get care for their patients, trying to get themselves compensated for work that they provided. They're banging their heads against the wall on this. And there is not a doctor in the entire state, I feel quite confident saying, that likes health insurance companies. In fact, if you look at some of the data around attitudes of physicians who have left the profession, which is a big problem, right? Where we have a shortage of doctors in some areas, particularly primary care, which is so important. When these physicians are polled, the issues that they point to are not, I'm not making enough money, or any number of other things. It's that they can't practice medicine the way they were trained and the way they want to. They feel that they cannot advocate for and care for their patients the way that they want and need to, because there is a profit-driven insurance company between them and their patients. So what single payer does is it takes the insurance company out from between you and your doctor. Medicare for All is not inefficient or unaffordable. In fact, it costs less than what we're spending now. Many of you probably have read statistics. We spend more than 2 times per capita on healthcare than any other nation in the world, and yet we get worse health outcomes. Here in Massachusetts, in Greater Boston, we're very proud of our medical establishment here. I think people have good reason to be. But if you look at actual health outcomes in the ways that the World Health Organization measures these things, the United States is not at the top. We are way down in the weeds. The most recent assessment that I read from a couple of years ago was places in the United States 19 among systems. And that includes not just wealthy nations, European or Western nations that have comprehensive single-payer systems. But nations like Costa Rica has a more comprehensive, more equitable healthcare system than the United States if you look at health outcomes, and of course they spend a lot less than we do. All of that money that insurance companies take for exorbitant CEO salaries, for stock buybacks, for lobbying, for advertising, for marketing, all of those costs disappear with a single payer system. That is just one way in which savings can be realized by single payer. Perhaps most important, Medicare for All will not take away choice or allow the government to choose your doctors or interfere with your health. Nothing could be further from the truth. Under the current system, you don't choose your doctors. Most likely, if you are like most people and you have health insurance, your employer chooses the insurance that you get or that you're allowed to choose from. And then the insurance company tells you which doctors and hospitals you can go to through restricted networks. So you have nothing to say about what doctors you see and what hospitals you go to. Under a single payer system, there is no such thing as provider networks. That was an invention of the insurance industry to make money. Under a single payer system, everybody in Massachusetts, if Senator Eldred's bill passes, please, every resident of Massachusetts can choose their own doctors, their own providers, and their own hospitals because they are all paid through the same single payer, okay? So currently, people have much less choice, and their physicians and their providers have much less choice about what kind of care you get. And then finally, I think that there are folks here in Massachusetts, I mean, there's a big economic divide in the state. We have a huge gap between, the wealthy and those who are not wealthy. But on the whole, Massachusetts is a wealthy state. There's a lot of resources here. So there are a lot of folks who feel, I'm safe, I'm good, I'm protected, I have insurance, I'm protected health-wise, I'm protected financially. In fact, and I mean, we heard the story of Susie. There are all sorts of people, an increasing number, who are underinsured. Either they can't afford the more comprehensive insurance that's more expensive, or their employers are cutting back because they don't want to spend the money on comprehensive coverage. So it's rather shocking to some people to learn that, but maybe not shocking, maybe you've all heard this, that the majority of bankruptcies, personal bankruptcies in this country are caused by medical debt. And half of those bankruptcies are for people who have insurance. So insurance is not protecting you from financial devastation. It can be easy to say, oh, I've got it, I'm covered. There's another important feature that I think a lot of people aren't aware of. Certainly underinsurance is one. Here in Massachusetts, we have, I think it's a 97% coverage rate, right? So we have virtually universal coverage. But universal coverage is not the same as healthcare. And universal coverage is only as good as that coverage is, right? So if you are underinsured and you cannot afford an extra unanticipated $1 or $2 or $5 or $10,000 in health costs, in a way there's something almost worse about being underinsured because you've paid for the insurance and you don't get the health care, right? I have heard it said, and I absolutely agree, that the United States has the most rationed healthcare system in the advanced world. The most rationed healthcare system. Because we self-ration. If you have to pay a higher and higher deductible, you're going to think twice about going and getting that throat culture, or going and getting that, pain checked out, or figure you're gonna tough it out because you've already paid your premiums, you're on the hook for another $2 or $4 or $5 or $6,000 before your health insurance even kicks in. So we ration ourselves. And Americans are more likely than people in single-payer systems to not get the care that they need because of cost. There's another phenomenon that a lot of people are not aware of. Under ACA, the Obamacare as we know it, I don't really think of that as healthcare reform. I think of that as a consumer protection program. And it accomplished a lot of important things, but it really came up short in a lot of ways, one of those being cost control. There is no mechanism for cost control, and we're all living with that here in Massachusetts. Our costs are escalating. We have the most expensive health care in the world here in this country, and I think Massachusetts has the most or the second most expensive health care in this country. So our health care costs more than almost any place on the planet right now, right? We can do better. Many people don't realize that under ACA, all of those consumer and patient protections were designed to apply to insurance companies. But more than half of the people who receive health coverage through their employer's sponsored program are self-insured. But you wouldn't necessarily know that, because what self-insured companies do is they pay all of the medical claims themselves, but they hire an insurance company to administer that program for them. And so you might have a Tufts card or a Blue Cross Blue Shield card or a Harvard Pilgrim card or whatever, but you don't even know that your employer is actually self-employed and self-insured. Self-insurers are exempt from many of the protections that came in under ACA and are also exempt from some state health regulations. An example being fertility treatment. In Massachusetts, it was legislated that insurers must cover fertility treatment. Self-insurers do not need to. And I knew of a heartbreaking situation of a young woman in her 20s who was suffering infertility, working at one of the major hospitals here in Boston, who was on the hospital's self-insurance plan and therefore could not afford fertility treatment. I mean, here we are in a medical mecca. We have the most advanced, high-tech, amazing healthcare, right literally a stone's throw away. And yet, a large portion of people do not have access to it, and I would venture that there are probably people in this room right now who are whose employers self-insure them or who receive self-insurance who don't realize that there are protections that they do not have. So there's all sorts of ways around I think that was an unintended consequence, but there are all sorts of ways around the ACA. As long as you have an insurance company between you and your doctor that profits by denying you care, we are never going to overcome that profit motive. We built an entire economy around it, right? We know we know how powerful money is. So nowadays, doctors, an increasing number of doctors support single payer. Nurses, the Massachusetts Nurses Association, the biggest union, has been a leading advocate of single payer for years and years. So the myth that that doctors will leave the profession, if we have single payer, doctors we'll lose doctors, is just not true. It hasn't happened. It didn't happen in Canada when they converted from a private insurance model to a single payer model. And I think most doctors would welcome it because they get to do the thing they were trained to do and don't have the headaches and the obstructions that they're dealing with. And all of the money, there's nothing in a single payer that can't compensate providers handsomely, as they deserve to be compensated. When we look at the money savings in getting insurance, insurance profiteering out of the system, all that money can be invested in healthcare itself. And that means compensating primary care physicians, family physicians, gerontologists, the people who are doing the frontline important preventative work. Those people, under the current system, are largely undercompensated. Finally, and I'll wrap this up, because I could go on, I could go all night. One of the, oh, wait a minute. Maybe I'll have to stop already because it just went right out of, I just had a senior moment. It just went right out of my head. Yeah, it's just, on the physician's end of things, I think that there's a lot of support. I know what I want to say. The senator mentioned that the AMA, the Massachusetts Medical Association, does not endorse single payer, but there is a significant movement within that organization looking to move that agenda forward. So I think that, and particularly I think around the younger docs, right? Younger docs coming in just have, the way I look at it is if you're brainy enough to be able to go to medical school and just accomplish that, there are so many other easier ways that you can make a whole lot more money. You go into medicine because that's your calling. This is the work that doctors want to do. They don't want to spend time fighting with, insurance companies. They don't want to suffer the moral injury that they experience when they realize they cannot provide the care that they are ethically and personally committed to providing because the system has gotten in their way.